So children are going to climb, they're going to run, they're going to bump their head. The vast majority of head bumps, or as we call them, head injuries, are going to be benign, meaning they're not that so important. They're not serious. A few are going to be more serious. So let's talk about some ways to keep your child safe and ways to know whether or not you need to seek medical care for the child that's had a head injury. So again, most bumps to the head are not going to be serious. You can't have a young child who's not going to bump their head. They typically are on the forehead because kids do fall forwards. Subhead injuries, though, can be more serious. There is a potential for serious, especially in a young infant, if they've been dropped from a height. And generally we say about 3 times the size of the child is a significant height for that child to have fallen.
So an infant, that's from your arms.
Right. Falling from being carried or falling from a changing table. If you have an infant that has had any of these things, you've dropped them, they've fallen off a changing table, they've fallen from a significant height, you need to call your doctor and get your child evaluated, or consider just going straight to the emergency room.
Now, there are certain things that should tell you you need to take your child to an emergency department right away. This isn't something to wait to call your doctor, not something to observe at home. If a child's had a head injury and they vomit, you need to bring them in for us to see, to make sure that that vomiting isn't a sign of something more serious going on. And what we're worried about isn't a skull fracture. Skull fractures are actually not that scary. What is scary is that brain underneath. That is so important for us to make sure has had no damage done. So vomiting may be a sign that there's been something that's happened to the brain. So any vomiting after a head injury, please bring the child to the emergency department. If the child was knocked out, basically had a period of unconsciousness for any amount of time, bring them to the ER. Let us take a look and see what's going on. It may be nothing, but that's something you need to bring in for us to evaluate. If your child persistently cries, you can't console them. They fell, they hit their head, and they're crying and crying and crying. Or your child has lethargy and they're just not acting normally. They're not using all their parts equally. They're hard to arouse. Even when you arouse them, they just aren't acting right. They're just not normal. Bring the child in for us to evaluate them. If the child is bleeding from ears, mouth, or nose after the child's had a head injury, bring them in so that we can see them and make sure everything is okay. And some people think that if they've fallen enough to get a bump on their head that is of any significant size, not a little Goomba, but anything that you're I would like to have that. Come on in, let us see them. And if your child is old enough to talk and they say, I have a headache or my neck hurts and I fell, they hit their head, bring them in. Now that doesn't mean that when you arrive in the emergency department, they'll do anything other than a really good examination and look at your child. We these days are really not CAT scanning very many children because very few of these children have significant head injuries where we really care about exposing them to, for instance, something like radiation, which is what a CT scan does. Often we can just observe the child, make sure we do a good exam, which is what we'll do. We'll test all the parts and make sure everything's working okay. And then we'll often just watch your child and make sure your child's doing okay. But we would like them in the hospital there so we can keep an eye and make sure everything's okay.
Exactly. So again, if your child's not in the infant age, if they're less than about 10, 12 months of age, if they have no signs of what Diane just talked about, some signs of head injury, if they're acting normally, observation of your child is perfectly warranted for the next day or so. But if you notice any of the symptoms that she talked about, your the behavior is not right, they're vomiting, they're sleepy, and you can't explain it, that would be a reason to get them evaluated immediately. Now, you bump your head, you're allowed to have a headache. You can use something like a mild pain medication like acetaminophen. We generally say stay away from ibuprofen in a head injury situation. Ibuprofen, one of the ways it works is it decreases the way platelets function, and platelets have to do with clotting. That's some area we don't want to get into in a child who's had a head injury. So really just stick with acetaminophen if you're going to give your child some type of pain medication. Again, this is a child who's acting normally, but they've got a big little kind of bump to their head, and you want to give them some type of pain relief.
There's a rule of thumb. It's
Stick to
a little
acetaminophen.
Hard as a parent. It's like, I know I can use either one for fevers or for pain. How do I remember which is which? It's a little tough. Just if there's anything that might be related to bleeding.
Stay away from ibuprofen.
Stay away from ibuprofen. So that's kind of one little rule of thumb where they're not interchangeable. When there's maybe some bleeding, it's acetaminophen that's the safe drug to use. And that's just one little thing that's kind of a little extra thing to remember about those two medicines. Now, one of the tough things to do is what do we do about sleeping? If we worry about lethargy and my child isn't acting normally, can I let them go to sleep? Well, here's some advice that comes from kidshealth.org. This is some advice as far as what to do if your child has had a head injury. Now, if it occurred right before bedtime, they're getting into bed, tumbled out of that first bunk of the bunk bed and bumped their head, has a bump on their head, otherwise it's okay, let them go to sleep, for heaven's sake. Same thing with nap time. Let them go to sleep. And just then intermittently, every hour or two, just take a peek. If your child's color is good, they're breathing normally, they're sleeping the way they would normally sleep, leave them alone. Don't bother to wake them. The idea that we used to, in our practices, both of us, way years ago, we used to advise parents to wake the child up every hour, was it, at some point. I mean, that's ridiculous for you and for your child. Most children with these minor head injuries are just fine. So let them sleep. Keep an eye, but let them sleep. That's completely fine to do.
Exactly. Now, additional advice from the same organization, kidshealth.org, says if you're not comfortable, you know your child better than anything. If you're not comfortable with your child's appearance or their behavior, trust your instinct, trust your gut, and get that child evaluated. Call your pediatrician. They're probably going to tell you, go get the child evaluated in the emergency room. If your child's sleeping, and again, you're a little worried about it, try waking your child up. Try rousing them a little bit. Most kids, they're just going to want to get a little bit fussy, and they're going to want to settle themselves right down to sleep. If you can't get them to rouse, try waking them up. If you can't wake your child up, that also would be a reason to go get your child evaluated emergently. Now's not the time to wait. If you can't wake your child up, that would be a time to go get evaluated.